as nurses, we know that having a good CNA or a not so good CNA can determine how your workday is going to be. Hello everyone, welcome to my channel. Thanks for watching, and today let's talk about certified nursing assistants or CNAs, and how as nurses we know that having a good CNA or a not so good CNA can determine how your workday is going to be. Now, depending on where you work, sometimes CNAs are called PCTs, which is patient care techs, nurse tech, nursing aide. But I'm used to using the titles of nurse tech or CNA. So those are the titles that I'll be using today when I'm talking. Let me start by saying that nursing techs work really hard. They really do. They're on their feet just as much as the nurses are, if not more, really. And they are definitely underpaid. And when you're working along a really good, competent CNA, it makes all the difference in the world. So today, let's highlight what it's like working with a really good certified nursing assistant. You know your patient's going to get good quality care, which affects patient outcomes and patient satisfaction. Your vital signs and blood sugars are going to be checked without you having to ask them. They'll report any abnormalities or any change in your patient's condition. The bed linens will be changed. Patients will be fed. You don't have to worry about the patients being fed. They'll notify you of any skin breakdown that they might notice. Sometimes there might be bathing the patient or getting the patients up for any reason and notice some skin breakdown. And a good CNA will notify you of that. They'll let you know. The grooming and hygiene needs are going to be taken care of. And those are just a few of the important tasks that the CNAs do daily, day in and day out. But they're definitely important major tasks. So especially if you have a total care patient, and sometimes you're worried that they may not get the care that they need. In a really good CNA, you don't have to worry about that. Certified nursing assistants, they usually spend more time with the patients than the nurses do. And sometimes they might notify you of something that's going on with the patient that you might not have known about. So that's another good thing about a good certified nursing assistant. Also, when you're working alongside a really good certified nursing assistant, as a nurse, you have a sense of relief because you know that your patients are going to get really good care. Because let's face it, as nurses, sometimes we go home overwhelmed and just feeling defeated because we feel like we didn't spend as much time with our patients as they deserved because we were so busy. So to all the good, hardworking certified nursing assistants out there, I just want to say thank you. We appreciate you, and kudos to you for providing good care to your patients. Now, when you are working alongside a lazy CNA, not being mean, there are lazy CNAs out there. When you're working alongside a really lazy certified nursing assistant, it makes for a really rough day, a really rough day. You end up, the nurse, you end up doing your job in their job because we all know as nurses, we are responsible for the well-being of that patient. So we want to make sure our patients are getting really good care to the best of our ability. So yeah, we'll end up doing our job in theirs. Sorry guys for the background music. I am in the lovely Dominican Republic out here in this beautiful, beautiful Puerto Plata right now. You can see this beautiful mountain side back here behind me, and someone's playing music. So I hope that you can still hear me and yeah, even maybe enjoy the music. So when you have a CNA that's not putting forth their best efforts when it comes to doing their job, as the nurse, it's important that we redirect them. Because if we don't and things are not getting done, who suffers? The patient that suffers, right? Yeah, the patient suffers, contributing to poor patient outcomes, and we really don't want that. So the nurses have to delegate and make sure tasks are getting done. Communication is key. We can't just let the CNAs sit around at the nursing desk or in the break room or in their favorite hiding spot. We all know about the favorite hiding spot, right? Yeah, there's always someone somewhere with a favorite hiding spot. There is absolutely nothing wrong with the nurse asking the CNA, did you get my vital signs? How about Mr. Wright's blood sugar? Can you get that call light for me? There's nothing wrong with us asking that. Like I said, communication is key. When you do it, just make sure that you're always respectful in asking those things. Now, with that being said, there are some lazy nurses. So can't get through this video without talking about the lazy nurses. Um, I don't like to see nurses sit and not help their CNAs. I personally always try to help my nursing assistants if I see that they're really busy and having, um, have a heavy workload. So nurses, please don't just sit at the nursing desk on your phone and not answer the call light because, a lot of nurses sometimes feel like it's not their job to answer the call light. Um, it is because, if that patient is calling and the nursing assistant is busy, then we need to get up and check on our patient. It's our job to make sure that patient is getting the best care possible. So if you see the nursing assistant is busy, then offer to help. Offer to get vital signs, check blood sugars. You take one end of the hall, let them take the other end of the hall. Work together as a team to for the betterment of the patient, to take good care of the patient, and to not work your nursing assistant to death. Like, don't sit there and let your nursing assistant work her tail off and you not offer to help. If your nursing assistant is busy and Mr. or Mrs. Wright asks for assistance to the bathroom, then please help them. Don't walk out of your patient's room and tell them that you're sending the nursing assistant in to help them. I know as nurses, we're really busy and we're always thinking of our next task and worried that we won't have time to complete all our tasks, but we have to stop what we're doing and take the time out to take care of our patient. Assist Mr. or Mrs. Wright to the bathroom, or put them on the bedpan, or give them a urinal. Whatever it is that they need, don't walk out of the room without helping them. We always want to make sure that we assist our patients and to help reduce patient injury. Because if we walk out of that room without assisting them and tell them that we're sending the nursing assistant in, it might possibly be that they are lying in a mess by the time that nursing assistant gets to them. Or worse, they'll get up and fall, break a hip or something, and we definitely don't want that. We want to decrease patient injury as much as possible. So please make sure that if your nursing assistant is busy, I know we're busy, but if they're busy, then it's our job to make sure that we take care of our patients. We want to always lead by example. Like I said, I always tried to help my nursing assistants. And if I wasn't around to help them, then they knew the reason I wasn't around is because I was busy myself. So always lead by example and help when you can. And I never asked the CNA to do anything that I wasn't willing to do myself. That's very important, just put it out there. Don't ask anyone to do anything that you're not willing to do yourself. Like I said, make sure that you lead by example. Yes, they work under our direct supervision. And yes, we assign tasks for them to complete. But in doing so, always make sure that you are respectful, never demeaning, never make anyone feel like they're less than or that they're lower than you. Always stay humble because we're all God's children, and no one is any better than anybody else. So, and when you assign tasks, it's important that the nursing assistant know that you're not assigning a task to be mean, to be spiteful, because you're lazy or because you don't want to do it yourself. Assigned tasks are expected to be carried out to ensure good patient care. Um, we are all there to make sure that the patients are well taken care of. It should never be anything else. It's always about the patient. We want to make sure that that patient's getting good care. And so tasks have to be carried out. They have to be completed. Not just the CNAs, but the nurses too. We all have tasks to complete. Um, Communication and teamwork is key. The goal should always be to take good care of the patient. Certified nursing assistants are an integral part of the team, and I couldn't imagine doing my job or trying to do my job as a nurse without them. So we want to always make sure that we let the nursing assistants know how much we appreciate them, recognize them for their hard work. Um, Always try to help when you can. Always promote teamwork. Um, yeah, because like I said, I can't imagine doing my job without them. Because, like I said, the ultimate goal is to work together as a team to take good care of the patient. That's what we're there for. We're there because we got into this because we care about people and that we care and we want to take care of people. And so, yes, and if that's not your goal, if that's not why you got into healthcare, then honestly, you probably just need to find something else to do because it should always be about the patient. And that's the end of my soapbox. So thank you guys for watching. Don't forget to like, subscribe, and share. And until next time, have a blessed day. Thank you.